Welcome everyone to our industrial hygiene seminar series on biosafety and biosecurity and public health. We're excited about today's presentation. We have really great speakers. Quickly, we're just going to do some basic just housekeeping. Okay, so we are the Southwest Center for Occupational and Environmental Health. We are the continuing education program here at the University of Texas Health Sciences School of Public Health. Best practices for a successful team session. If you are using a VPN, you may have a difficulty connecting, so please disconnect your VPN. All attendees will be muted for this session, so if you have a question to ask one of our speakers, we ask you to use the chat box, and at the end of each presentation, our presenters will be answering questions. Video cameras are only being used by our presenters today, so attendees, please keep the cameras off so we can maintain connectivity speed. And please close all other applications. And just to let you know, this event is being recorded. Just a quick overview of our agenda. We have Dr. Alexis Mraz, who will be talking about is personal protective equipment worth the hassle, annual risk of cryptosporidosis to dairy farmers, and how personal protective equipment and hand washing can mitigate it. We will have a very short break. And after that, we will have Corrie and Ntiforo from the University of Texas Medical Branch to talk about biological safety and high containment research in healthcare facilities. After that, a quick break. And then we will conclude with Dr. Lisa Becton, who is the Director of Swine Health at the National Pork Board, and she will be talking about biosecurity in the swine industry, benefits for animal and public health. Then we will have our wrap-up, last-minute questions, and we will talk about evaluations. A little bit about us. We do occupational and environmental health. We do training programs, education and research on industrial hygiene, occupational epidemiology, and total worker health. We do outreach and continuing education on each of these programs. So we do a lot of training and we help people maintain their certifications. We also do research and practice to promote health, safety, and well-being for workers and their communities, including our pilot projects program. Save the date. So we have upcoming events. These are all virtual events. We have our journal club, which is November 16th. We have our program with the Texas Physicians for Social Responsibility on November 27th. And we have our environmental health and research seminar later on today. These are all virtual. And the above three are also free. Our next industrial hygiene seminar series will be February 9th. So please circle that on your calendar. If you would like more information, please visit us at SWCOEH.org. So with that, we will go on with our very first presenter. So we have Dr. Alexis Mraz from the College of New Jersey. Dr. Mraz is an assistant professor of public health at the College of New Jersey. She is an environmental microbiologist specializing in quantitative microbial risk assessment. Welcome, Dr. Mraz.
Hi, thank you so much. It's really nice to be here, and thank you all for joining, especially, it's early in Texas. But today I am going to be talking about an introduction to my field, which is quantitative microbial risk assessment, which you'll often hear as QMRA. And I'm going to use a case study we did recently on cryptosporidiosis among dairy farmers in New York and New Jersey. So just some background on what QMRA is. This is a systematic framework for integrating science, data analysis, and mathematical modeling to assess risk, or at least predict the likelihood and probability of risk. And that risk can look at like a few different things. It could be an infection, it could be illness or disease, based on the exposure of a pathogenic microorganism. So we're looking at a microorganism from a specific source, and then we need to identify and look at different pathways of exposure that could cause disease. So the first step in this is hazard identification. We want to look at what the pathogen is and what the health outcome is. And for this case, our pathogen of interest is going to be Cryptosporidium parvum. Cryptosporidium parvum is a protozoa. There are a bunch of different Cryptosporidium species. The two that make human sick are parvum, which we're focusing on here, and hominis. Hominis is really specific to humans, but parvum we can see in a few different species. So parvum can live in the digestive tract of different mammals. One of the mammals that it lives in is cattle, which is why our focus here is on cows for this case study. It can also live in the environment.
Really quickly, Dr. Mraz, we can't see your slides. Are you sharing?
No, I'm so sorry. It's great. You know, we're 3 years into a pandemic, and how long have we been doing this for? I'm so sorry about that. Can you see the slides now?
Yes.
Okay, wonderful. Thank you. Sorry. So just so you could see kind of the outline of what QMRA is. This model I'm going to come back to, so don't, you know, we don't have to have too much pressure to take it all in right now. But for the moment, we're focusing on what that pathogen is and the health outcome. And this slide actually shows Cryptosporidium parvum, which is our pathogen of interest in here in this case study. And one of the things about crypto, so I'll refer to it as crypto a lot, which is just kind of the shorthand. I know with cryptocurrency, for a lot of people that took another meaning, but Cryptosporidium is a protozoa. And protozoa can insist and survive for very long periods of time in the environment. You'll see on this slide, you're actually looking at the protozoa in the cyst. So those cysts can be really hardy. It prevents the pathogen from desiccating, so it can live in the soil for a while. It can live in this case, cow feces for a long time. It can survive in surface waters. It prevents chlorine or other oxidative stresses from really getting to the pathogen. So even in environments like chlorinated water, the protozoa tend to survive and tolerate those environments. So what we really need for treatment is filtration. Protozoa, Giardia is another example of protozoa. So filtration is really what we are looking for when we're trying to remove it from an environment. The disease endpoint here is cryptosporidiosis, which is a gastrointestinal illness. For the young, the healthy, cryptosporidiosis tends not to be a big deal. It tends to be maybe a few uncomfortable days that you want to stay near a bathroom, but hospitalization rates are low for the young, for the healthy. But for the very young, so the under 5 population, the older population, the immunocompromised, this can very easily turn deadly. So we are concerned about this, even though in the US, we maybe don't always take GI illnesses as seriously, because it is easier when you have access to clean water to rehydrate, to prevent some of the issues that cause mortality. We do see mortality with cryptosporidiosis in the US, but particularly in these more vulnerable populations. When we are determining risks to humans, we're looking at a few different pathways here. So we have occupational risk. This is predominantly farmers and veterinarians. Hominis, which is the other Cryptosporidium that makes humans sick, we don't see frequently in other mammals. We do see parvum frequently in cows. So farmers, farmhands, anyone working around cattle is going to have exposure to Cryptosporidium parvum. and veterinarians that go to the farms have exposure. So a lot of times veterinarians will be there if the cattle are sick, and then they themselves can get sick from the cattle passing the pathogen. Cattle, there are some cattle that can just be carriers for crypto, so they might not be symptomatic, but they will spread the pathogen when they defecate. Typically, we see symptoms in young cattle, and that symptom is typically diarrhea, and the cattle can succumb to it as well. So treatment for cryptosporidium in cattle is just supportive. So similar to humans, they're just ensuring that the cattle are going to remain hydrated, separate them from the rest of the herd so that they don't spread it, because it is quite easy to spread, especially if cattle are in close quarters to one another. And there are a lot of farmers that take pride in the types of food their cattle are getting. There's not much of a link there between the food they're eating and crypto. It's more that their living quarters are clean, that they're not very close together, and that when an animal is sick, they're being isolated from the rest of the herd. Other risks to humans are recreation. So we see recreation in both surface waters, so rivers, lakes, and in pools as exposure points here. Like I said, the protozoa is very resistant to chlorine. So if the filtration is working in a pool or a splash pad, for example, that will help remove a lot of it. But if someone is actively sick, or if someone is shedding the protozoa and they're swimming in the water, the chlorine's not going to kill it on contact, so anyone around them could get sick from it. We see the protozoa surviving in like on banks of lakes and rivers fairly regularly. So sometimes that recreation can turn up that silt on the side and end up allowing the protozoa to kind of be free in the water and for ingestion. So any head under recreation, any recreation that's causing water to be ingested can be a risk factor there. And then, of course, those drinking contaminated water. So filtration is the best prevention for any protozoa, including cryptosporidium, but just chlorination, iodine treatment, UV treatment itself is really not doing the job to reduce the risk of pathogens here.
Okay, Incorporated. This is Joy. Hi, Carol. Good. All right.
So there are outbreaks of cryptosporidiosis in the US. Our most common outbreak here is in pools. So this is, anyone who's swum in the pools has seen the don't swim with diarrhea signs, whether active or in the last 14 days. And obviously that can pose a risk to other swimmers. Also childcare facilities. So the spread of any GI illness in kids under 5 is fairly prevalent. There is risk to the other children at the childcare facilities, as well as any of the workers. So if you're, changing a diaper of a sick child or cleaning up after a sick toddler, you yourself would be at risk for cryptosporidiosis. Like I said, we're going to be focusing here on the cattle. So this is representative of about 15% of outbreaks in the US. And the main recommendation here is to wash hands after touching animals, which is probably fairly obvious and feels like maybe something everyone does if you are not necessarily working in the field. I realize I can't see you, so maybe taking a poll doesn't make sense. But I mean, if you have a dog, have a cat, how many of you are washing your hands consistently after interacting with your animal? Maybe sure after you pick up their fecal matter, but even feeding the dog. I have a dog. I know I'm supposed to wash my hands every time I feed him. I don't wash my hands every time I feed him. I forget frequently. this is my job, right? I assess risk for a living, so I know my chance. I know there's a risk there when I touch the dog food and then go back to what I'm doing, and I still, you know, frequently, probably more frequently than not, forget to wash my hands after I feed my dog or give him a treat. So if you're working every day on a farm, you're used to these animals, this is really secondhand, that wash your hands after touching animals warning comes off differently in, you know, your occupation than if you were at a petting zoo, for example. So we're specifically looking at the risks to farmers. And my initial thought going into this study, my, you know, perception of farmers tends to be young, healthy. I wasn't as concerned about the farmers themselves getting cryptosporidiosis. What I was concerned about was the farmers getting cryptosporidiosis, then bringing it home to their families. If they had young children, if there was someone immunocompromised in the house, if they were living intergenerationally, that coming home sick, you could easily spread this GI illness in the home. However, once we started sampling at the farms, then to give you an idea of what our samples look like, we were sampling at all family-owned farms, typically fairly small. Our biggest farm had over 100 head of cattle, but not by a lot, I think about 120. Most of our farms only had a handful of cattle. So some farms had as few as 4. So we sampled at 7 different farms. We had 70 samples. And while we were there, we really got to talk to the farmers, interact with them, kind of get their perception of what their risk was and see how they interacted with the cattle. The one thing I will say is, you know, these were family farms. The farmers we interacted with definitely cared about their animals. So a lot of what they were doing in terms of PPE or personal protective equipment was not to protect the farmer, it was to protect their animals or their milk. So we were at all dairy farms, and there was a lot of concern and just taking precaution around ensuring that the milk was not contaminated. So typically we saw farmers interacting with the cows. If they were not milking, there wasn't gloves, there were no masks. We were sampling amidst COVID. So we were wearing masks, which only 1 or 2 farmers really commented on. But the comments were in relation to COVID-19 as opposed to in relation to zoonotic disease and the prevention of zoonotic disease. But while we were on these farms, the first thing I really realized was that my perception of what I thought this age group of farmers was going to be was way off. A lot of farms were intergenerational. We saw typically 2, often 3 generations farming together at the same time. So it was very common for the grandfathers or the grandmothers to still be working with the cattle. So that age group that we were worried about in the older population range, we were worried about farmers bringing this disease home to them. It's not about bringing it home because they're on the farm, they're interacting with the cows and their fecal matter. We also realized that a lot of times farmers either lived very close to the farm or literally on the farm. Their house was on the same property and their children or grandchildren were around. One of the women at one of the bigger farms, as she was helping us sample the calves, her daughter stopped by with her granddaughter, and her daughter went in to do something, and she just strapped her, I think maybe 6-month-old granddaughter to her chest and kept helping us. And this was definitely second nature, you know, not really a thought. Her daughter grew up around cows, This is this woman's livelihood. Having the baby around the cows was not a big deal to any of them. But that baby getting sick could definitely be problematic with cryptosporidiosis. So we were curious about perception of risk from the farmers and then actually calculating the true risk to the farmers. We really found that the farmers did not perceive that they were at a great deal of risk from zoonotic diseases. They all understood what zoonotic diseases were. They all understood that their cattle could carry cryptosporidium or giardia, and their concern was really for their cattle as opposed to for themselves. As the scientists, we were wearing gloves, we were wearing masks, we were quite conscious of washing our hands before sampling, just to be respectful of where we were and their animals, and after sampling for our own health, we were sampling cow feces. But the farmers were, I would say, for the most part, fairly dismissive of the fact that we were wearing PPE or asking about washing our hands. So one thing, in addition with protozoa, is that hand sanitizer really doesn't work for cryptosporidium or protozoa in general. So washing your hands with soap and water is important. Just using hand sanitizer isn't going to cut it. But as we were sampling, we would get comments like asking if we were uncomfortable or if we just wanted them to do it because we were wearing PPE. And some farmers had said, like, well, you get used to this, you're around cows every day. Like, one farmer had wiped poop off of her arm and had said to us, it's just a little poop, you're around cows you're around this every day. It's almost like when you have a kid and you forget that changing diapers is gross. And we got comments like that a lot, where this is not a big deal, you'll get used to it, it's just a little poop. And that gave us a little bit of insight to the perception of risk and whether or not PPE seemed reasonable or worth it to farmers. So the next step of the risk characterization, the QMRA model we want to look at is that dose response. For dose response, we want to look at the concentration of the pathogens and the modeled response. For the concentration of the pathogens, we looked at the concentration of Cryptosporidium parvum in feces. We use quantitative PCR for this, so qPCR. And if you're not familiar with PCR, we're going to extract DNA from the feces. We used a stool DNA extraction kit to extract the DNA, and then you're replicating that DNA until you can get a reading from it. So we're making standard curves and calculating our gene copies per reaction from there. So we're able to determine the number of gene copies of Cryptosporidium parvum per gram of feces. And we also calculated the prevalence in the feces. So not every cow had crypto. So we had just under 13% of the cows were positive for Cryptosporidium parvum. And then the other section of the dose response model is looking at how that in this case ingestion of the pathogen affects the general population. So we're looking at a dose response model. We did not perform the dose response model in this study. We used Messner's dose response study here. Do you want to show you, if you are using QMRA currently, if you're interested in QMRA, can you still see my screen? It should be quantitative microbial risk assessment, this QMRA wiki.
No, we don't see the slide right now.
Okay. Sorry about that. Okay, so I just want to share with you this QMRA wiki quickly, because it is a really productive resource, in my opinion. So it has all the different steps of QMRA, different case studies in here, different pathogens. The dose response section of this wiki is something I use constantly. They do have completed dose response models here by pathogen type. So just looking at the Cryptosporidium parvum, I'll give you a general overview and a summary of the data, but it has this really nice summary chart of the different dose response models that have been performed. And what I want you to pay attention to here is we have our exposure route, your strain, which depending on the pathogen can be very important, and then our disease endpoint. So in this case, I did choose the recommended model here, which was the Messner 2001 model. I chose this model because it was an oral ingestion route, which is what we were looking at for this exposure type. The isolate that they used is one of the more common isolates, especially to cattle. The dose units was in oocysts, which is what we ended up calculating. They're all in oocysts for this one. And then if you actually look at the model, the doses were just more similar to the doses we were seeing. So this ended up being a good model for what we were looking at. And the end point here was infection. So sometimes the endpoint is the infection. So this is whether or not the human subjects in this case had Cryptosporidium actually infect their digestive tract. Sometimes you select the endpoint as an illness or specific illness. Like in this ID 181, it's diarrhea. But it's important to note which one you're looking at. So that's where we got our dose response data from. Let me get back to our slide. So we're using that exponential dose response there. And the parameters we need there is that K parameter. This ID 50 is the infectious dose in which, or the dose in which 50% of the population will become infected. Next, we want to look at the exposure assessment. So in this case, we're looking at a cow that defecates, the human that is interacting with the cow, whether it's milking, cleaning up the feces, mucking out pens, whatever it is, that interaction, that we get some feces on the hand, and then the hand eventually touches the mouth and the person ingests those feces. Our parameters that we're looking at here, first I have that limit of quantification. So if you have used PCR before, you know we have a limit of detection. We need enough gene copies in that sample in order to be able to detect it at all. If you've not used PCR, this was talked about a lot during the early stages of the pandemic when they were still trying to get tests out and running. So we have that limit of detection, which depends on each assay, and then our limit of quantification. So for this, if we had below 1,000, about 1,500 gene copies per gram, then we couldn't quantify accurately. We couldn't quantify the amount of crypto in that specimen. but we could still detect it. Then we looked at our geometric mean we used for concentration here. The geometric mean was good. It was the best fit for this data because we had some very, very high samples. So we had samples some samples were on the lower side, but we ended up with samples that were just very, very high in crypto. And the geometric mean was a better distribution than the median or the arithmetic mean. Our percent positive fecal samples was 12.9%. And those three were calculated from this study. In order to calculate the ingestion of fecal matter from the farmer, we used this Evers et al. 2014 study, who looked at, well, exactly what it says, the ingestion of fecal matter from farmers by calculating the amount of feces that got on farmers' hands and the amount of feces that were transferred to the lips. The exponential dose response parameter came from that Messner study I just showed you. And then we also had to calculate the probability of illness given infection. So that Messner study, our endpoint there was infection. So just that your GI tract had gotten infected with crypto, but not necessarily that you were sick. So we used that probability of illness given the infection from this Murphy et al. 2006 study, or sorry, 2016. So those were the parameters we used to determine risk in our scenario of no personal protective equipment. But we wanted to look at those other specific scenarios as well. And those other scenarios we wanted to look at was with PPE. So what changes when we have gloves versus if we're wearing a mask, if we're adequately hand washing, or if we're doing some combination of the three. And in order to assess that, we really needed to look at how the pathogen would be reduced or how the exposure to the farmer would be reduced by these different interventions. So the first one we looked at was hand washing. This is pathogen reduction directly from the hands. So pathogens are reduced by, it was about 90%. They were reduced down to 1% during hand washing. And that US FDA study is specific to protozoa, which is important when we look at pathogen reduction because protozoa are more challenging to remove than bacteria or viruses. For our mask reduction, we looked at the reduction in mouth or lip touches when someone is wearing a mask. And this was a study that observed that directly. And the assumption here is if you can't touch your mouth or your lips, you can't transfer fecal matter to your mouth or your lips. For the gloves, we had to look at it in two parts. So the one was when you're wearing gloves, you're less likely to touch your face, specifically, PPE, rubber gloves, for fairly obvious reasons. So we looked at the reduction in lip touches when someone was wearing gloves, and then after they had doffed the gloves, there is a transfer from pathogen to hand after you remove the gloves, but that was accounted for. So how many pathogens would be expected to be transferred to the hand, and then that was used for mouth touching after the gloves were doffed. And the rest of the parameters are the same there. And this is what our annual risks look like. These are some violin plots. I like violin plots in situations like this where we're really seeing, we have some data points that are really right skewed, like no PPE, and then other data points that are really more centralized. But you'll see that risk of cryptosporidiosis to dairy farmers really varies in that no PPE column. And then we're moving away, so our annual risk is in the bottom, and it really decreases with each of these different types of PPE. So if we want to see it in a more traditional box plot, we can see that no PPE on the right side definitely has that highest annual risk, which is not surprising. And then we're decreasing with masks, with hand washing, with gloves and hand washing, and then our overall risk, if we're wearing all the PPE, is the lowest here. But we are seeing a spread, right? We're seeing a lot of outliers. We still do have risk, even with wearing all of the PPE. That median risk goes down a lot, but there are a lot of outliers for that annual risk. And looking at this in, actual numbers for annual risk. So the risk was annualized, assuming farmers were working 50 weeks out of the year and 5 days out of the week. So our risk, if we use no PPE, was about 0.29. With just hand washing, that was reduced to 0.147. With just gloves, that was reduced to 0.048. So gloves by themselves were the most effective PPE alone. The mask was 0.111. When we combined our hand washing with gloves, it was reduced down to 0.039. And then our hand washing, gloves, and mask was reduced down to 0.013. So when we go from no PPE to all three interventions, we're going from, you have almost a third of a chance of getting sick that year to down to, a 1.3% chance of getting sick with cryptosporidiosis that year. The thing that we thought was interesting here that I wasn't expecting was all of these reductions were significant. So if you go from nothing to just hand washing, that's a significant reduction. Nothing to just gloves, just masks, that's significant. But even if you go from gloves to hand washing and gloves, so if we go from gloves to both the hand washing and gloves here, that reduction is significant. Or from hand washing and gloves to everything over here, that reduction is also significant. And that's important here because you're trying, well, we need to know that you're actually reducing the risk in a significant manner before you're suggesting people do things they don't want to do, in order for them to see the need of doing it. There's a few different reasons farmers or farm workers don't use PPE at the rates that occupational health professionals would like them to. In some cases, there's a really big study for Latinx community members that were working on farms about why PPE was not used. And big takeaways were comfort. A lot of times you're working in uncomfortable conditions. It can be hot. You're outside, gloves, masks, not necessarily comfortable. If there are undocumented workers on the farm, even if they see the need for it, they have less power to speak up and request it if the farm owner is not providing it. There is the cost of providing it. And then a lot of farmers see it as an environmental issue. A lot of this PPE is disposable, and they just see it as more trash building up, an unnecessary waste, to be blunt. So if you're not seeing a real reason for doing this, then why spend the money? Why suffer the discomfort? Why cause or contribute to a growing environmental issue? Hand washing was something, so we really didn't see glove or mask use on the farms. The only glove use we saw was when farmers were actively milking cows. And like I said, it was for protection of the milk and the cow as opposed to protection to the farmer. Hand washing varied a lot amongst the farms. Some farms had multiple hand washing stations in convenient areas. Some farms didn't. And as a result, we just didn't see people wash their hands as much. I will say where hand washing stations were convenient, we did typically see farm workers washing their hands more often. We did have a chance to publish this paper a couple months ago, so it's in Microorganisms. If anyone is interested in what we just went through, you can get a more in-depth reading of it. We thought it was an interesting study. I really enjoyed doing it. I worked with two of my really awesome master's students, Nandini Matiala and Shauna Cleary, on this, as well as one of my colleagues at TCNJ, Brenda Seals. And we, really got to learn a lot being at different farms, talking to different farmers, understanding different perspectives on occupational risk and their thoughts of how much or how little they were at risk for things like cryptosporidiosis. And we enjoy getting to work through the process and then also see the outcomes. Would really like to thank the Pilot Projects Research Training Program of New York and New Jersey Education and Research Center. That's through the National Institute for Occupational Safety and Health through this T42 grant. So they were the reason that we were able to implement this study, and we really appreciate being able to do this as a pilot study. As I said, it was small. We were only at 7 farms with 70 head of cattle. We would really like to expand it, especially in different regions, to be able to get some more data and more information. But working with the farmers and understanding more about their occupations was really worthwhile and fulfilling for this grant. And then if you were curious about any of our references, I would be happy to send you any of this too, or it's in the paper as well. And with that, if there are any questions, I would be very happy to talk to you.
Thank you, Dr. Mraz. If you have any questions, please put them in the chat.
Can be about the study specifically or QMRA in general.
Well, if there are no questions, we can take a 15-minute break and regroup at 9:30 for our next speaker.
Thank you so much for having me, for your attention. And if you come up with any questions or thoughts later, please feel free to send me an email. It's mraz@tcnj.edu. And I would be really happy to talk to anyone. Love talking about QMRA, and this study was really fun. So please reach out if anything comes up.
Hello, everyone. Welcome back. And we will get started with our next presenter, Corrie Ntiforo. Corrie is a lead biosafety professional, biosafety officer, and alternate responsible official for the Select Agent Program in the Biosafety Department at the University of Texas Medical Branch. She is responsible for the daily oversight of the biosafety programs in high and maximum containment facilities, the management of the UTMB Select Agent Program, and safe operations of research activities ranging from BSL2 to BSL4, including animal and arthropod facilities. She provides technical expertise, strategic leadership, and support to academic and healthcare enterprises on regulatory compliance and best practices in biological safety. So please welcome Corrie Ntiforo.
Thank you so much. I just want to check and make sure everybody can see my slides, okay?
Yes, we can see them.
Okay, good. Like Alexis said, I know we've, 3 years in, but you never know if you've hit the right button. So first of all, thank you so much for having me today. I have quite a few slides, so I'm going to try to move a little quickly. I had a hard time figuring out. Yes, unmuting helps. Thank you. So I'd like to just talk to you guys today, give you a brief overview of UTMB in case you're unfamiliar with really what we're known for. We are both a healthcare and an academic and a research institute. Give you a little overview of biosafety and specifically at UTMB, some of our, what I would say, fun things we do on a daily basis. And then, of course, I'd be remiss without mentioning regulatory framework, regulations and guidelines that we're required to follow in the research arena. And then lastly, talk to you about how and why our program is successful at the end of the day, working with some of the pathogens that we do and how we build that culture of safety and responsibility and how that really is a foundation of what we do here. So in case you're not familiar with UTMB, on the health system side, we have 4 campuses that are spread out. We do service about 2/3 of the Texas population, maximum containment, maximum security prison hospital. So we service about 2/3 of the state, Texas state prisoners for their health care. We have about a little over 1,000 patient beds, 150 clinics that are, spread out through most of Southeast Texas, but some that range all the way down to the border. We are a level 1 trauma center, a level 1 burn center, and we have a biocontainment critical care unit, which I'll talk about a little bit later, how that kind of spills over into our research side and vice versa. On our academic and research side, we have a School of Medicine. We were one of the first school of medicine here, and that mainly is, of course, because of our location next to the port and having a lot of things that come through the port. People and plants and animals carry things and a lot of infectious disease, and it really is a foundation of why we do what we do here today. We have a Nursing and Allied Health, School of Public Health and Population center, and then we have a really awesome, if you haven't been here, seen it, we have a health education center. It's the building on the bottom left. This is a 5-floor state-of-the-art building. It's a total simulation facility, from surgeries to NICU to OB, you name it, it's there, and it's a really new building, and it's really great to have here on campus. Of course, infectious disease research. We have several of the NIAID centers for research in emerging infectious diseases. We run an international biosafety training center out of our department. And then we, I know this sounds silly, but an on-site incinerator. If you've ever been stuck figuring out how to get rid of waste, including Ebola patient waste, we were called upon a lot during the 2014 and 2016 Ebola outbreak, where, as you know, people didn't want to take waste, including your normal contractors, for fear. So we were called upon by the state to dispose of a lot of that medical waste. If you're unfamiliar with the research side, we have the Galveston National Laboratory. That is the large, tall building in front. The one in the back with the red roof, that's our Keeler building. So we call this the G&L Keeler Complex. And then if you look a little bit beyond that, in the back is actually the first medical school. We call it Old Red. It's that really nice, pretty red building in the back. So the Galveston National Laboratory was started construction in the mid 2000s. It wasn't really up and operational until about 2010, and it was brought up in various phases. This project cost about $173 million. This was part federal grant that we received and part state funding as well. We already were in operating biosafety level 3 and 4 prior to the Galveston National Laboratory being funded. That was part of the reason why we did receive the funding, as we already had expertise on an academic campus operating a biosafety level 4. And after 5 years, we were able to start using it. So a little bit about the Department of Biosafety. This isn't an all-inclusive thing, but I tried to break out maybe specific categories that our office deals with the most. Our probably largest program that we have and takes the most amount of time is our high and maximum containment program and our biosecurity program. That includes the Federal Select Agent Program oversight, which I'll touch on later, but we also do a lot of clinical biosafety. We intersect a lot with infection control on the healthcare side, and there's, as kind of clinical case complexity increases with infectious disease, they'll often call upon us to help, as that really is our expertise, even though we're not infection control professionals. So we do a lot of clinical biosafety. Animal biosafety program, given the amount of animal research that we do and the various species, these range from, rodents, bats, goats, sheep, things that fly, like, mosquitoes, ticks, all sorts of things. So we do a lot of animal biosafety. Of course, training is a foundation of mostly what we do. Institutional biosafety committees, which many of you are probably familiar with, is run out of our office. Of course, laboratory inspections, and then the normal, HEPA equipment and things like that. And then shipping. Shipping is a large portion of what we do here. We've opted to try to do all the shipping for our campus, so that it takes that burden and risk really off of the university. So just for some consistent verbiage, I know people are probably familiar with this, but when we say biosafety, we're talking about safety measures that we're putting in place to minimize and hopefully prevent exposure to the agents that are handled in the lab, but also our job is to protect the people around the laboratories and, most importantly, the community and the environment that surrounds us. We are not in the middle of nowhere. We have houses right across the street. So people know when our generators come on. They sometimes will call and ask, we hear the generators, is everything okay? So we have a lot of close neighbors. So we have to keep everybody in mind. And when we apply biosafety, this is a combination of lab practices, procedures, the facilities that we're going to use, and then the safety equipment that we're going to implement when working with these agents. I'm not going to go over this. Everybody understands what a risk assessment is and where we draw the line for risk management. But just like everybody else, we have our own way of doing risk assessments. And for us, it can be easy, like you know exactly what you're working with, or it can be a little bit more difficult where perhaps these are field collected specimens and you think you might have an idea of maybe what was circulating in the area that somebody went and collected, serum or swabs, or I caught mosquitoes in West Africa, kind of thing. So that can really change based on the probability of exposure and how we handle those samples downstream. So for us, the first thing that we look at in a risk assessment is try to understand what the risk group is. And so risk groups are assigned based on the hazardous characteristics of that agent or that pathogen, that known pathogen, of course, right? So we're looking at whether the pathogen can produce an infection in humans. Can it produce an infection in animals that maybe live close by, that if there was an escape or release, that would be a problem? If it can produce disease, is it something that's acute? Is it something that is severe? Do we have therapeutics for that? Are there vaccines that we can give, prior to the personnel working with this pathogen? And then are there any serious sequelae associated if somebody was to become sick and develop disease? And then we have to look at the greater population. So we touched upon in the last presentation about those vulnerable populations. Of course, it's age. Now, thankfully, in the laboratory, we don't need to worry about, small children. But that doesn't mean that people can't have underlying medical conditions or be in the older generation where age may be a factor for your risk. So we do take into account not just humans, but animals as well. and the communicability of that pathogen. So the pathogenicity, the virulence, and what does that look like? And what would be the impact if something was to be released, whether that be an occupational exposure or a release into the community. So just a couple things that we look at, agent stability in the environment. So, how long can it survive on a stainless steel, on a countertop, on a floor? If you were doing animal studies, does the animal shed? How does it shed? What does that look like? Concentration, the origin of the sample. So is this something that we have grown and we're using in the laboratory, we produce it ourselves, or is this something that we've acquired, from the field, and there could be other things in that sample that we need to consider. Volume, we have some regulatory requirements if you're under a certain volume of agents. So if you are working with under 10 liters, you follow one thing. If you're working with larger volumes, you follow another thing, but also the concentration or perhaps the titer of that virus in that sample can change how you may assign things. Also the route of transmission, not only in nature, but how do we manipulate agent in the laboratory and make artificial means for inoculation. So once these are identified, now in the NIH guidelines, there are a list of agents and the associated risk group. Now it's not a totally exhaustive list, but it is a pretty extensive list. So the first thing that we're going to is we're trying to find out what's that risk group so that we can understand the hazards. And then from there, we can assign a biosafety level. And then just as a reminder, biosafety levels and risk groups are not always equivalent, but in order to assign that containment level, first, we start with the risk group, and then we try to understand what are they doing with the agent? How are they manipulating it? What types of facilities do we have available to us? Because we may assign it differently depending on facility design. We do have very specific government oversight where we do not have a choice what biosafety level we work at, but then there are other places where your institutional safety committees or local ordinances do have the ability to do that risk assessment and assign appropriately. And for us, of course, biosafety levels will range from BSL-1 through BSL-4. There are some enhancements that we can use in some of the facilities, which I can talk about in a little bit, but this is what we're looking at. So as we said, risk groups are really fixed. Now, if you go to another country, the risk group can vary. So maybe, yellow fever is a good example. So yellow fever here would be a risk group 3. But if I go to an endemic area, say, South America, it's going to be more likely be a risk group 2. It's already endemic. Everybody's vaccinated. And so the risk is different there. Biosafety levels are fluid. This can totally change from my entity to an entity down the road. And again, it's going to depend on the manipulations, the regulations, also just the comfort of the entity. Some places will be very conservative and they're like, we try to take no risk. And then other entities are, we know we have trained people. We've been doing this for a long time. We're comfortable working with it at a little bit of a lower level, still proper, right? But that can vary even institution to institution. So how do we achieve containment? So containment, most importantly, is about how we work. We can get really fancy with PPE and engineering controls and build the most fancy, building that we can, but the most important part is that human factor, as it is in almost everything, and how people work is the most important part. I always tell people, in the 1950s and 60s, they weren't working in fancy buildings with fancy equipment and HVAC systems, right? They were working on an open bench, not even in a biosafety cabinet. Did people get sick? Absolutely. But did everybody die? No. And it's because they had really good microbiology practices. So there are other things that we can do, such as primary containment devices. These are things with O-rings or directional airflow, which helps provide containment when we're doing high-risk procedures. Of course, PPE, but as everybody knows, PPE is not the thing that you want to rely on solely unless you have no other option, like, being in a room with a cow. I can't really put a cow in a biosafety cabinet, right? Or do other things. And so there are some instances where your PPE is the only barrier between you and the hazard. But of course, if we can avoid that, we do. And then, of course, facility design, how it's constructed, how it operates. But this is a really important barrier, as this is what is going to protect people not only outside that initial laboratory, but most importantly, the community. So biosafety level 1, these are non-pathogenic agents to healthy adult humans, not to young children, not to immunocompromised people, but to healthy adults. Things most commonly we see are non-path E. coli, but in a standard laboratory, you should still have a sink for hand washing. You still have emergency equipment such as an eye wash and a shower. People still should be following good lab practices, wearing gloves, and working in specific equipment like a fume hood if you have chemicals, and a lab coat to protect your street clothes. When you move to a biosafety level 2, this is the most common lab that we would find on a research campus. And these are when we move to more bloodborne pathogen type of agents. And this is where you would find, your typical bloodborne like hepatitis B, HIV, salmonella, crypto, we heard earlier. These are all common BSL-2 agents. You will see signage should begin to change as you go up in level. So if you noticed on the door sign for BSL-1, there was no biohazard because there should not be any biological agents that are hazardous to humans in a biosafety level 1. So you may see chemical or radiation signage, but not biosafety signage, right? Now, most campuses will throw a biosafety level sign up anyways because it's consistency. But other than that, you're going to start to see some of the biosafety cabinets move in for working. This is providing directional airflow. It protects not only the person, but the sample and the environment if you're using a class 2. You should have an area for waste decontamination. And then we start directional airflow. Now, directional airflow is not required in a BSL-2. It is highly recommended, of course, in the BMBL, but certainly not required. But we shouldn't be sharing air with the lab next to us. It should be direct exhaust air so that if I do have a spill outside of containment on the floor, I'm not sharing that. It's not recirculating into the next room, right? For biosafety level 3, this is where we're now starting to be concerned with pathogens that can be transmitted via aerosol. These are often agents that may not or may have vaccines and treatments, and this varies greatly, of course, with the agents that you're working with. Usually they could be indigenous or perhaps they are exotic. Some common ones, yellow fever, a lot of the rickettsial pathogens, monkeypox, or we should say mpox now, Sonombre virus, some of your high path influenza viruses, those sorts of things where you're really starting to worry about that aerosol transmission. Or maybe it's just something new and we don't feel comfortable downgrading it yet because we don't have enough information to do that. Now, in BSL-3 facilities, you're going to start to see more on the facility design side where we're starting to see anterooms and multiple doors. This is usually in a separate or isolated zone. It's just not in an area where people can just walk in. We definitely have directional inward airflow at this point. This is one way we do provide containment is with moving air the direction we would like to from the cleanest part of the building to the dirtiest part, which would be inside the laboratory. At this point, we want to make sure that room penetrations are sealed. We don't want, if there is an agent escape outside of primary containment, we don't want it, going into the walls. And so things, around your sockets and your seams all need to be sealed and things like that. It also needs to be easily decontaminated. So there shouldn't be porous material, wood, things like that, where we couldn't come back in and clean properly. And then you can just see how the directional airflow works, cleanest to dirty. So one thing that we do here that you may not see at other institutions is we do a lot of arthropods here. We love mosquitoes and we have a lot of people who do tick work. And this directly correlates with those pathogens that are arthropod borne. So some of them are, yellow fever, Japanese encephalitis. We do a lot of tick-borne studies as well. So, bourbon, in BSL-4, we do Crimean Congo studies with ticks and things like that. So we do a lot of arthropods. So if you have not seen an arthropod containment facility before, you'll notice right away, it looks like we're almost perhaps in an insane asylum, right? Where everything is white. The only thing we're missing perhaps is a padded wall, but this is really important that the facility be as minimal as possible, and we want it to be white so that if there is an escape of an arthropod, we need to be able to identify it and find it very quickly. It's not acceptable to have an escapee and not find it. So that's why you see everything is white. You see the individual at the top, she's actually working with ticks, and she has a white Tyvek suit on. They pull the gloves up over their cuffs and they put sticky tape, going out so that if there is a concern, we use the arthropod biology against them. And so if you can learn the behaviors of the animals, and in this case, the arthropods that you're working with, you can find actually very easy ways to control them. And so some species can actually, I kind of joke, some of them will do, we'll test our methods, and we call them tick races. And so we'll line the different species up on a particular sticky pad or maybe a specific type of tape, and we see who can make it through the sticky pad. And some species cannot, but some species have really long legs and they actually can just stand up and they can walk. And so this helps us identify proper barriers to use that are species specific. And then we, of course, do mosquitoes. Now, if you're a safety professional, we're always like, work in the cabinet, work here, over here. Some of these things don't work in an arthropod facility. If you put a mosquito under an area where there's a lot of airflow, of course, the mosquito blows away and it's going to be in your HEPA bank. So there are some different things. We have to be creative often for working with arthropods. So this is just some ways that we contain the arthropods. We do barrier and a barrier and another barrier and another barrier. So we are not relying on the room as the primary barrier. We store them in vials with proper screening, and then they go into a container at the top right. This is a container that will sit in the incubator. We also can use these are large glass jars on the bottom left. This one is kind of phasing out, but it is a way we put Vaseline on that top. And so even if they get out of the primary container, they can't get out of the secondary container. And then you can see on the bottom right is a third level. This is our incubator. This keeps them happy at the proper humidity, but we put sticky tape. That blue outline is sticky tape. And so even if they get out of the first one and the second one and the third one, then we have another barrier. And then if you look at the room level, you can see that we have sticky pads and tapes, and we use a tangle trap. It's a really sticky kind of glue, and we outline the doors and any area where we have an exit. Now, a lot of people just assume when a tick gets out of a capsule, it's like, I know where the front door is, let me run, right? But that's not the case. If a tick is what we call questing, he's either looking for blood, or I should say she's looking for blood to feed, or they're looking for a place to lay their eggs if they've already fed. And the front door is not that. So we're not really putting them there because we're worried that that's where they're going to run, but it is an exit point. But it is important to know where all the holes are in that room, because they're trying to find a nice, area to go lay their eggs. Now, we also keep the room at a very specific temperature and humidity, because often ticks aren't going to survive in the room because it's not enough humidity, the temperature isn't right, and they'll often desiccate. So again, these are ways that you can use the environment against them and help provide containment. And then on the right-hand side, you can see somebody's working with mosquitoes. She's doing a blood feed. That Hematech feeder at the bottom contains blood. So this is an artificial feeding. And the mosquitoes are kept in that ice cream container at the bottom with a netting. And so you just put the feeder on top with the blood, and then the mosquitoes will come up and feed. And she's working in a glove box. So again, a container in a container in a room. So lastly, biosafety level 4, of course, is the highest containment that we have, and this is where we are working with pathogens that are lethal. They most often don't have FDA-approved vaccines or treatments. Some do, but these are our hemorrhagic fevers. Obviously, this is a very high individual risk if they were to be exposed, and a high community risk most often. While not all of them are communicable to another person, still high risk. So in a BSL-4, you can have two types of BSL-4 facilities. You can have the one on the left, which is what we call a suit lab, which people are most familiar with. You get in a spacesuit, you have supplied air. The one on the right, though, is a Class 3 biosafety cabinet. This is a completely sealed chamber, and it is not open to that room. And so this is where we perform aerosol procedures. So Unfortunately, the agents that we work with are potential bioterrorism weapons. And if we were concerned about a bioterrorism event, we would most often think that that would be dispersed via aerosol. So we need to make sure that we can mimic those conditions when we are testing vaccines and therapeutics in a situation where we are concerned. And so we can aerosolize the agent properly in a safe system, and we can either do environmental kind of degradation studies, or perhaps we need to have the animal model mimic that inhalation disease so that we can ensure that the treatment or the vaccines that we are giving them protects them against all different types of routes, not just an injection, but an inhalation event. BSL-4 facilities obviously are much more convoluted than a 2 or a 3, as they should be. And what you can see is most often BSL-4s will always be on the second level of a building, because you need the air to go up somewhere and you need liquids to flow down so that you can decontaminate them. So here's the BSL-4, and then air, all the air from the laboratory is going to go up to the HEPA deck, where we will filter it 2 HEPA filters in series before it leaves the building. And then liquid will flow down from the drains, and it will be collected in the effluent decontamination system, or EDS for short. And this is where we can thermally ensure that everything that leaves the laboratory has been decontaminated. Now, we don't just dump Ebola virus down the drain, right? There are administrative ways that you lower risk. So we're always chemically inactivating things before we put them down the drain, even though they are going to the EDS. But again, it's about mitigation. Here are a few different types of BSL-4 suits, or positive pressure suits, that you may see. So if you've seen the blue one, that's the Dover, that's the American-made suit. They actually are no longer manufacturing these, but you still may see pictures of them. The one in the middle is the Spirian, or the French suit. And these are, I would say, the most common ones, are also the ones that you see in the movies as well, even though they clearly had them retrofitted for the movies, because I'm like, hey, that's not where the vent is, but I'm sure for camera angles it looks better. And then the one on the far right is a German suit. This one is becoming more popular as other suits are phasing out, but this I call the bumblebee suit. So when you're entering a BSL-4 laboratory, you're going to don your suit in a safe area, what we call the suit room. You're going to walk through the chemical shower. The picture on the far left is an individual who's entering the laboratory. They're going to walk through a set of double doors, which is our chemical shower, and then into the laboratory, where you can see people working in the other pictures. And you can see the yellow hoses that come down. This is supplied air. So you have to connect your hose in order to receive that air. You disconnect and then reconnect as you move about the laboratory. So unlike other types of PPE that we're most often used to seeing, like a respirator and a BSL-3 that is a negative pressure system, that you're actually pulling air through a filter to provide the user with clean air, we're doing the opposite here. We are blowing air away from us, so we are in a positive pressure environment instead of a negative pressure environment. So it does take a little bit of getting used to. It has its own set of hazards, pros and cons, but these are things that you incorporate into your training program, so people do understand if your tubes are not inflating properly, you can become hypoxic. So when you're ready to exit the laboratory, you're going to go back through that chemical shower. And this chemical shower is for your suit, not for you as the person. And this is just microchem. 5% microchem is the standard for what we work with. The good thing, viruses in the BSL-4, which are only viruses, by the way, we do not have bacteria in BSL-4, are very wimpy. And so the good news is we can kill them quite easily with 5% microchem, 3-minute contact time. So you walk into the chemical shower, it is 4 minutes of microchem, and then it will be followed by a few minutes of water, and that water is just to rinse the suit so that you don't have that residue. And then you will exit out of the chemical shower into our suit room, where you doff the suit, and then you'll actually take a personal shower as well. You're not wearing street clothes in, what I call your birthday suit. And then you get your scrubs on, long sleeve shirts, you have a pair of inner gloves that come up and over, and you tape, and that's what you're wearing inside the suit. And then on the bottom right, you can see these are our big tanks of microchem. So these sit 1 floor above the laboratory, and this is where that chemical is feeding from when you're in that chemical shower. We also have hoses that feed into like our dunk tanks and things like that, so we can mix up top and then deliver. The other reason why they're above is for gravity. So you can see in the chemical shower that emergency deluge that's like right in the middle of those yellow hoses. If in case we ever had an issue where the chemical shower for some reason was not working in its normal operating sequence, we always have an emergency deluge, and that will be fed via gravity. So HEPA filtration, we have most of the floors that you saw in that really tall picture in the beginning are mechanical floors. And that's where, to me, all the fun stuff is, but a lot of people don't get to see those floors. It's also where all the money is. So we have to have very specialized pieces of equipment. We have actually more than one floor that's dedicated to just HEPA units, and you can see some of those pictures. We have over 1,400 HEPA filters just in the GNL. And these are, of course, what is protecting our community. So in BSL-4, you're required to not only have one HEPA filter, but 2 HEPA filters in series, so one after the other, before it can go to the building system and then eventually out. And these are certified, of course, every year as you would for any HEPA filtered equipment. So now the not so fun stuff, regulatory wise, but also very important to understand that we are highly regulated when it comes to high and maximum containment. And really even beyond that, there are a lot of recombinant DNA guidelines. We have select agent regulations. While we're not an OSHA state, of course, it is best practice to do certain things. And then we are guided by the BMBL for our day-to-day kind of risk assessing. And that is what we're inspected upon. So that when the federal inspectors show up, they're inspecting us right out of the BMBL, in addition to what it says in their particular regulatory code. After that kind of US side, we've got the federal side, and that can vary by grant. Sometimes granting agencies want to come inspect you. If you have BARDA or DHS, they're going to come inspect you on top of the federal inspections. We also have institutional level, of course, of oversight, and that's your IBC. These are policies, and this is training, things like that. And then the PI has their own set, and then of course the laboratory personnel have their own responsibilities when it comes to compliance. So here's just a very, very short list of things to consider. I'm definitely not going to open the can of worms of dirt today, but it is a very popular thing at the moment where people are trying to see where there may be a gap in oversight when it comes to dual use and actually really what does dual use mean and pathogens of concern, or what does gain of function really mean? It's very easy to say, but what does that truly mean when it comes to the research that we do? Every institution is required to have an institutional review entity. This board is the one that is responsible for that dual use and P3CO oversight. As far as the NIH guidelines, if you've not had the pleasure of reading these, it is a good nighttime novel to read, and you read it, you'll be confused. I've been reading it for 16 years, and it's still, the language is still confusing to me. They are in the middle of updating, but the last update and what we're operating off of currently is the April 2019. And this really is for recombinant DNA, synthetic nucleic acids. And again, what we most often look for to this guide are the risk groups of the pathogens that we're working with. And so what is recombinant DNA? Currently, the definition is molecules constructed outside of living cells by joining natural or synthetic DNA segments to DNA molecules that can replicate in a living system, or synthetic DNA segments that could yield potentially harmful polynucleotide or polypeptide and are equivalent to their natural counterpart. So some examples are, transgenic animals, if you're genetically modifying certain cell lines, any of the vectors. So even things like lentiviral vectors that most people kind of brush off and say, oh, they're not hazardous, right? AAV, cloning plasmids, human gene transfer on the healthcare side. So it is an all-encompassing thing. So who has to follow these guidelines, which really are in a way regulation, but we call them guidelines, are if you work at a research, or you work at an institute and conduct research, or you receive let me start over. If you work at an entity that receives NIH funding, okay, and that doesn't mean that project is funded by NIH, but if you receive any support from NIH, you have to follow these guidelines across the board. Any research that involves testing in humans of materials containing recombinant or synthetic nucleic acid molecules. developed by funds. So this really is an overarching thing at a lot of entities. And then select agents. This is what I live in and drown sometimes in every day. So Federal Select Agent Program is a program where there is a list of, I think I have it in a second, a list of agents that are deemed potentially to be bioterrorism weapons. And these are divided into human pathogens, plant pathogens, and animal pathogens. A subset of these pathogens, however, has been designated as Tier 1, and they are perceived to be at a greater risk for environmental impact, mass casualties, maybe could be just completely devastating to our agricultural system. Like, imagine if African swine fever made it to the United States and wiped the pork out, right? So I'm not a plant person, so I can't speak on plants, but animals and on the human side, I can, but a lot of damage could be done to crops. So who manages this program federally? So this is a joint program that is run both by CDC and USDA and specific divisions within those units. And these are the people that also will inspect us. So if you are registered for human pathogens and animal pathogens on the list, both entities will come and visit you. If you're only registered for human pathogens, USDA will not bother you. So currently 68 agents on the list, and about half of them we're registered for here at UTMB. So if you're not familiar with how these select agent regulations came about, it really started with some misuse of ordering pathogens. There were, in the mid-1990s, a microbiologist was arrested and convicted of mail fraud because he was able to misrepresent why he wanted 3 vials of Yersinia pestis. Today, that is a Tier 1 select agent. It was not back then, of course. So in 1996, the Anti-Terrorism and Effective Death Penalty Act was instituted. And basically what this did was allowed HHS to, 1, make a list. So put everything that you think is a public health risk on this list, and that's what they did. It then required any entities who had possessed these agents to register or get rid of them. But all they really wanted to know back then was, because of what happened the year prior, is just tell us when you send it to somebody. Other than that, we don't want to know what you're doing. Only if you're going to ship it, though. Then, of course, 9/11 occurred, and that's when the U.S. Patriot Act came out, along with other acts that gave them more authority. So this was the Bioterrorism Preparedness and Response Act. And this allowed them to strengthen the oversight of those pathogens and to have a more stringent registration process. So with the executive order in 2010, then they started prioritizing those agents. Some are more dangerous, some are less dangerous, but we all want them on the list. And that's when we started kind of figuring out, okay, maybe we should take some of them off, but then there's also toxins on there. So toxins are actually managed by a quantity, not I can have some, but I can't have so much. And then it really enhanced the physical security requirements so that we are preventing unauthorized access to these areas. And then lastly, Tier 1 agents. So here's a list. I know it's small and I apologize, but you can see in the bottom right how toxins are managed. And some of these are pretty common toxins that you would find in laboratories, especially immunologists. They love SEB toxin. We have a little bit of T2 toxin, but not meeting the threshold or the amount in that right column to make it a select agent. So that can be a little bit more tricky to manage because you have to make sure the PI stays under the amount. Otherwise, it magically turns into a select agent. If you're unfamiliar with kind of what the U.S. looks like when it comes to select agent registrations, about 35% of the entities registered with FSAP, Federal Select Agent Program, are academic, as we would expect. It even breaks it down by biosafety level. So 30% of the registrants are BSL2, ABSL2, 80% are BSL3 and ABSL3, and then 3% only hold a registration for BSL4 and ABSL4. And we are one of 2 academic BSL4s in the country. The rest are either, there's one private one in San Antonio, and then the rest are government. So it is an interesting kind of spread of where those lie. So we are required to be registered with the program. You have to designate a responsible official. We jokingly say the designated go to jail person, because really the regulation doesn't hold the PI or the entity responsible. If something goes wrong, the responsible official is the one that will go to jail if something goes wrong. And then we have to be inspected. So we are inspected every year for our high and maximum containment facilities by the Federal Select Agent Program. So a little bit beyond the research side, so we touched upon having a biocontainment unit. So after the 2014, 2016, or kind of in the middle there, HHS decided, you know what, we may not be as prepared as we think we are, and we really need to designate some facilities throughout the country that if a patient comes in with a high consequence pathogen, there needs to be a specialized facility for this. So they divided the country into the 10 regions. It initially was a network of 10, one facility in each region, but then that has evolved to 13 today. And this network is called Regional Emerging Special Pathogens Treatment Centers. It used to be Ebola for obvious reasons, but of course, we've recognized since then Ebola is not the only thing that we should be worried about coming into the United States. Or I always like to bring the research side in. You know, what if we were to have a research accident and a possible exposure? We need somewhere where we can bring these patients and they can be treated safely. And we are lucky to have this on our campus, given the research that we do. So these are biocontainment care units. UTMB is one of the dedicated BCUs in the country. And so we have a 6-bed facility designed similar to what you would see in a BSL-3, anterooms, you know, all the penetrations are sealed. We have directional airflow. We did build this adjacent to our emergency department very specifically because we don't want to have to worry about if you have a patient come in or you have a patient that's being transported to you that is infected or possibly infected with a high consequence pathogen. You don't want to be trailing them through your whole hospital system, right? So we actually have an outside exterior door that enters right into our unit, which is great. So it goes right from the ambulance, and I would say the door is about 15 feet away. So it works out really nicely. We have point of care laboratory capabilities. We have telemedicine, waste management, and things like that. So on the biosafety side, we are highly integrated into the BCU. We actually provide training alongside the nurses and the doctors. We train EMS. We do drills. There are patient transport and regional things like through SetTrack that we are involved in as well. And this is really important on the research side as part of my incident response plan as well, because I know the Select Agent Program knows that we can take care of anything that happens to one of our laboratory personnel as well. So I always, when I talk to people, it's nice to have these fancy research facilities, but it is your responsibility to make sure that you have the capabilities to take care of a situation if it was an exposure. Now, other things that we have to think about too are if we do have a possible exposure, there are other things, not just the agent maybe, but what kind of species? If it was an animal, some animals naturally harbor zoonosis. We do work with non-human primates, and specifically the old world macaques do naturally harbor B virus, which can be deadly to humans. And so these are other things that we have to take into account. And make sure that we have diagnostic capabilities or things set up where we can send samples to make sure we know what that risk is when we're treating somebody. And then lastly, culture of responsibility. So this is really, really, really important. And I think, honestly, the foundation of what we do, as we talked about, people can be really great technicians. We can build these fancy facilities, but everything comes down to, at the end of the day, is personal suitability. Is this person suitable for working in this environment? And sometimes the answer is no. And I tell people that's okay. This is not a stress-free environment. You need to have a certain, I say, containment brain mindset, and not everybody has those skills, and that's really is okay. So personal suitability is something that we've been doing from the day that we've been working here. It has since also become partly regulation, but we have been doing this from the very beginning. And what our concern is if you have somebody who could potentially be a risk for an insider, so this is somebody who has access to the agents and works with them, but could potentially misuse them. This became a little bit more stringent, of course, after the anthrax bioterrorism events, where it is still believed that a researcher from UTMB, the anthrax strains were traced back to a very specific PI at a laboratory. Unfortunately, we'll never know the truth, but after that, it enacted a lot of other mandatory personal suitability. But like I said, we were doing it way before that. So we are required, though, to have pre-access suitability checks and then ongoing suitability checks. So what we do before they enter, and then how do we ensure moving forward that they are continually suitable. We do have ways of monitoring behavior. This can be something like a direct observation. This can be self-reporting. Many times people will come forward and say, you know, I'm just really not okay. Maybe they had a death in the family. Maybe they're going through a divorce. Maybe they just have a lot of outside pressures, or it could even be work pressures, right? And they know they're not in their right mind, and they will say, I need to opt out for a little bit. And we say, no problem. And then you have peer reporting. So we have to be able to have mechanisms for people to come forward and say, I have a concern about somebody, their behavior, their normal behavior we know is this, and something happened, and their behavior now has become a different pattern. Not a bad day, not a bad week, but we're now moving into a different pattern here. So this really does have to be a whole person assessment, not just personal suitability and mental kind of health, but are they medically suitable to work in that environment? Do they have any underlying conditions that could make them more susceptible to acquiring a laboratory-acquired infection? Is there a chance that they could pass out in the laboratory? So we're monitoring those sorts of things. And then most importantly, security background checks. We need to ensure that people that we're allowing into these spaces to work with dangerous pathogens, you know, don't have certain things in their background that may make them higher risk to do something. And unfortunately, some of that is a lot of that is completely out of our hand and is managed by the FBI. And they will come back and tell us if somebody is restricted or approved to work with select agents. So we kind of talked about this already, but suitability starts at the hiring process. If you have somebody who applies for a job and lies on their resume, or maybe they say they have a certain degree and they don't, you know, that's down to honesty and trustworthiness, right? But maybe they pass all those pre-access suitability requirements, they pass their medical exam, you know, no problem, and they start working in the lab. What do we do ongoing? So every 3 years, we have to go through a renewal FBI check, and so they continuously check our backgrounds to make sure nothing else has come up. And then internally at UTMB, we're also doing annual background checks ourselves. Because we may have higher standards than the FBI. And so we may say, we don't want to take that chance, or until you get that cleared up, you're not going to be working in the laboratory. We also have medical evaluations that does include a personal suitability assessment. So this is questionnaires on culture of safety. You know, how do you feel about certain aspects of safety? How do you feel about reporting? Would you report your supervisor? You know, sort of thing. And then we do talk about, you know, drug and alcohol abuse. I know it seems silly, but it's important, and some people will self-identify. So those are things that we need to look into. Then every year we ask the supervisor to attest. We have a list of things that we send to the supervisor and ask them to go through with each individual working in their laboratory. You know, has anything happened? Do you still feel they're honest? You know, that sort of thing. And sometimes they'll get flagged and we'll have to review that. And, you know, that's our ongoing suitability. So as you can see, many layers, but insider threat awareness is an issue and it needs to be addressed. And this is actually a regulatory requirement. So we do have to provide insider threat awareness training every year to everybody working in high and maximum containment. And that's so that they have the tools to be able to recognize what should be reported. And we can do this in various means. You know, we have a great UTMB police department here. They have great training. They sometimes will give seminars. I can have the local FBI come and they can give more kind of localized regional things. So we kind of change it up a little bit. But most importantly, they need to understand and know what things should I be concerned about, and what are those behaviors maybe that should raise a red flag and I should say something about. And sometimes they can be life things outside of work, but there also can be work triggers, like a bad performance evaluation, or maybe they're upset about their job duties or things like that. So we try to give them those tools to identify and recognize. So again, I think the culture of safety is really the foundation of trust, working together. As a safety person, I know sometimes safety people aren't always welcomed with open arms, but we work really hard here to be a permanent figure in the laboratories. And I never want anybody to say, oh my gosh, why is Corrie in the BSL4 today? Did something happen? Are we in trouble? Right? But no, they don't do that. Instead, they wave and they say, hey, Corrie, what are you doing today? And we even have them, most of them actually will come before they start projects. They ask us to be involved from the very beginning because they know that we're here to be their advocates. We want them to do their research. Our job is just to make sure that they can do it safely and compliantly. And I'm their advocate when it comes to the government. So government comes and asks me a bunch of questions, and I want to be able to intelligently and accurately defend them. And so the more that we can be involved in their daily activities and understand their research and why they're doing it a certain way, it is the best thing. And it takes all of us to do a risk assessment, not just biosafety. I can't be an expert in everything that we do here. And so they're part of that process, and we take into consideration their expertise, but it also is a top-down approach. We can't have the people at the bottom wanting one thing and leadership saying, we don't care about that. That's not important, but that's not the case here. Culture of safety is really important here, given what we work with. And that starts at the very top and is funneled down, and anything less than that is not tolerated. So thankfully, that makes my job a lot easier, as I've worked at other institutions where you didn't have that institutional support, and it makes your job really hard, right, to do what you would like to do. So I guess my point is all of this leads to a reduction in risk, all of these different components of what we have in the program. And I could spend a week telling you about programs, but try to give you a small sliver of some of the piece of the pie today about how we kind of integrate all of this. I will say the most important thing, and I try to say this wherever I go, is community transparency. We obviously do some very high risk things here, and we never, ever want our community to think we're not being transparent, that there is secrecy, or we are doing something that puts them at risk. So from the very, very, very beginning, and way over 10 years ago, we developed a community liaison committee. This is made up of people from our community. They cannot have any ties to UTMB. You cannot work here and be on the CLC. It needs to be somebody else. And these are leaders in our community. These are lawyers. These are doctors. These are, you name it, we've had them. But they are instrumental in advising us. We meet with them every other month. They come to the GNL, and we have an hour and a half meeting, and we tell them about what's going on. We tell them this is some new research that we would like to be doing, but it could be a little controversial, giving the microscope right now on research. And they listen, they advise us, they say, ooh, we don't think that's a good idea. The community might think this, or they say, you know what, this is perfect, keep on. Probably the most controversial when I go to other biosafety meetings is reporting. So we report all of our incidents in high and maximum containment to the CLC. So if there is a potential exposure or if there is a release, we report that immediately to the chairs of the CLC. They determine whether this needs to go to the broader board or if we need to release this to the media. Like, does the public need to know about this? And what they say is what we do. They have said only, I've been here 12 years, and only once have they said you need to go to the public, and that was when we had a missing vial. And they said people need to know. And we did. We blasted it all over TV. CDC wasn't very happy with us, but we told them this is the agreement with our community, and we will not breach that. So in addition, we do post on our website all of our incidents. Again, I know this can make people cringe a little bit, but it is part of our transparency. So you can find this on our website. And I think that's my last slide. So thank you very much. I hope that wasn't too much all in one, but I appreciate you guys listening, and I would be happy to answer any questions.
There is one question in the chat. It says, how much training do those who service 1400 HEPA filters receive? Hours of training or a certain certification?
Great question. Yeah, so ours are NSF certified, but we employ them ourselves. There are people who you can contract to come in, but we want somebody who works for us because we have the ultimate responsibility, but we also want to be able to supervise. And I also think when you employ people to do these services, they have a better investment in their work because what they're certifying also is protecting them. So, but they are NSF certified and they do work under a biocontainment engineer. We have very specific engineers for biocontainment, and that is that those services are led under him in conjunction with biosafety. Oh, cybersecurity. Oh, yes. A whole another topic about cybersecurity. There are actually a lot of federal mandates for cybersecurity as well. We actually have done a lot of work to actually even isolate our complex away from the rest of campus so that if there was being an healthcare entity, we know often that healthcare entities are targeted, right, for hackers. And we always want to be sure that we can flow as an island, even from the rest of campus. So we don't want the rest of campus to ever be the reason why we get a virus or we're infiltrated. So our complex is completely cut off from the rest of campus. And actually, campus IS doesn't even have access to a lot of it. So we have our own IS specialists just in this complex. And we have a lot of rigorous cybersecurity here, as you can imagine, but we are continually, though, trying to see how can we isolate ourselves more? How can we isolate ourselves more? And we have a mechanism that if we ever did have a concern and we lost maybe our security system and that sort of thing, we have one plug. All we have to do is do this and we're isolated. So we actually do drills on this. So we'll have somebody outside come up with a drill, and then we will run through the drill and everybody has their component and everybody needs to go. And then we come back at the end and we say, okay, what went well, what didn't go well? How can we protect ourselves better, if this happens again? So great question.
If there are no more questions, we can regroup at 10:45 for our next presenter, Dr. Lisa Becton. Thank you, Corrie.
Thank you so much.
Welcome back, everyone. And our next presenter is Dr. Lisa Becton. Dr. Becton is the Director of Swine Health with the National Pork Board and utilizes more than 30 years of experience to focus on research, education, and outreach regarding all aspects of swine health management. Dr. Becton received her doctorate in veterinary medicine from North Carolina State University, her MS in food safety from Michigan State, and is a diplomat in the American College of Veterinary Preventive Medicine. Please welcome Dr. Lisa Becton.
Hi, thank you very much. I'm going to go ahead and pull my slides up. And let's see, where's... All right, so what I'm going to discuss, well, first, can you all hear me okay?
Yes.
Okay, great. Today I'm going to take a little bit different tact, really coming at biosecurity in the swine industry from a veterinary perspective and covering a lot of the basic principles and tenets that we use and advise our clients or producers when we're developing a biosecurity plan and program, and why it's important not only for their health, but for the health of their animals. Okay, let's see. Well, okay, let me hold on for a second why this is not going through. Yeah, as many years as we've used Teams, and this always has to happen, doesn't it? Okay, let's try this again. And see where we're at. Okay. So biosecurity, when I went back to just kind of understand the origins of when it started, really it was referred to managing bioweapons and terrorism. And obviously those are things that you want to exclude from any target population that you're working with. A couple other definitions that I dug up really look at protection of both humans and animals against disease and other harmful agents. And then lastly, really covers the introduction of pathogens or bioexclusion and reduction of spread of pathogens, biocontainment. And those are really all things that we're very interested in swine health production, because that directly impacts what we do with our herds and the health that we protect. Okay, I'm not understanding why this is not working. My apologies for this. I don't know why this is not working. So we may have to do a little bit different. And I really don't know why this isn't working. So let me try again. Again, my apologies for this. Okay, there we go. So I guess the question comes back is, why do producers care about biosecurity? And there's several different reasons. Obviously, we've got we care commitment to our producers and to our community around us. So focusing on the protection of people, pigs, and our environment, because our producers are actively impacting all of those, and we want to make sure we're doing the right thing. Obviously, when we produce healthy pigs, we get a healthy farmer. And from that standpoint, yes, there is a financial stability and health, because regardless of where people are coming from, whether they're an owner, an employee, a worker, a contractor, they all rely on pork production and healthy pigs to pay their income. And so if we keep those pigs healthy, we guarantee everybody income. And lastly, but probably most importantly, is we do produce pork, a consumable product for our consumers that we want to make sure remains a safe, healthy, and wholesome protein for people to consume. So as I look at this from a veterinary perspective, our biosecurity really does play a role in maintaining both our animal health and our public health, and especially our workers. Oh, heck. All right. I'm not sure why this is happening. So we're going to punt. again, my apologies. You think I've never worked in this before. So I'm going to stay in this version because for some reason it's not wanting to convert. And now it's not even wanting to move. Oh my goodness. All right, so other things that our biosecurity does in production, it keeps our pathogens out of our farm, and that's the biggest thing. Because while we do have a lot of vaccines on hand, a lot of those vaccines don't halt pathogen introduction, but instead really reduce the amount of side effects. So whether that be a weight gain, that might be the amount of cull animals or substandard animals that are produced, but vaccines really don't prevent introduction of pathogens. And so therefore, we've got to find another way to make sure that our prevention is a foundational step of what we do. And so development of our biosecurity plans is absolutely critical to get that done, because without it, we're limited on our tasks. So we do have some challenges in production to really have to deal with. One of those is when we train our workers and even our other staff, things that we're doing have to make biologic sense, but they also have to be easily implementable and doable on a day-to-day basis. Because if we can't address those two things, then we're missing our mark. Within our workforce, we do tend to have high turnover in certain sections, and that's just the nature of our business. We also have a lot of non-ag experienced people that come in as our workforce, and so have no agriculture background or understanding of production. And so that's something that we also have to work with. We do deal with language barriers, and that's just also, again, something that we have to deal with in our industry, but it does make a bit of a challenge when we're trying to convey different concepts for biosecurity and herd health. We also have to do with many moving parts within production. It's not just one aspect, but it's transportation, moving pigs from farm to farm or farm to harvest. It's how we bring supplies into our units, how we remove mortalities, looking at our feed entry, manure hauling and handling, and then our semen handling or germplasm, because just about all of our production is into artificial insemination. And so all of those things add up to having potentially individual biosecurity practices associated with them. So when I come back and look at how do we develop a plan, I try to convey it to producers that it's a step taken around or even in the farm to reduce the disease introduction into a herd. And it comes back to incorporation into the daily work routine. Because if we can't have people do the same thing in and out each and every day, it makes it very, very hard to continue to have an effective biosecurity plan. And I think that holds true even with the previous speaker on what happens in BSL-3 and BSL-4 facilities. Same thing in production. I always look at it, it should make biological sense when we're assessing our plans. So are our procedures based on our knowledge and research of the pathogen? Will the procedure actually reduce the risk of transmission? Because again, we need to ensure all of those things are incorporated into our plan, or a plan will not be as effective as we hoped. So what are the tenets that I think about? Really, it truly is understanding our targeted diseases. And unfortunately, we have many that we deal with in swine production, majority of those being swine-specific pathogens, but not all. So we try to incorporate the current research on pathogen survivability, both within the pig, outside of the pig in the environment, and on other surfaces, or even in other media such as water or feed. And then also understanding pathogen spread and transmission. Is it aerosol? Is it pig to pig? And I'll have some examples afterwards. And then looking at mitigation strategies. Are our pathogens sensitive to disinfectants we commonly use? Are they sensitive to heat? Are they sensitive to drying or sensitive to changes in pH? All of those things do make a difference when we consider a plan. A second factor really is adapting this to pig flow, and I'll have an examples of what I mean about that. But all of our farms, we have over 61,000 producers in the U.S., and a majority of those farms are not the same. And so we have to look at how each different farmer flows their pigs and flows their barn, and then apply our plan to that. And then lastly, applying it down to the farm level and how people implement this. So when I look at disease transmission, there are several routes, and this is no surprise, but we look at different routes. Really, the direct route is going to be the most common, pig to pig, whether it's, nose to nose, pigs licking each other, licking through crates, but the direct route is really the most route that we are concerned about. However, the others do come into play as well. So indirect, such as aerosol, even windborne, that's going to be a concern for certain pathogens. Vector-borne comes into play, both through mosquitoes, ticks, and fly bite because of blood-borne diseases. We also have fomites. Those are another big one, such as dirty boots or equipment, our trailers that are used to move animals, needles, syringes, anything that could touch a pig can potentially be a fomite. And then lastly, and probably more recently, we do look at foodborne spread. And so our feedstuffs have been shown over the last years to be able to harbor and maintain certain pathogens. We've known that with such things as salmonella, but now we're also looking at other pathogens that can remain viable, both foreign animal diseases to swine as well as domestic diseases of swine. And so that's another area we really have to monitor. So what are some examples and how do we deal with that? So we have the fecal-oral spread is pretty common, especially among our enteric pathogens. So porcine epidemic diarrhea virus, a coronavirus that we deal with, rotavirus and salmonella bacterium, all we focus on preventing exposure by removing contaminated manure if it's in a pig area. And obviously we want to prevent that coming in by also making sure that trailers and people don't have manure on them when they're coming to a farm that doesn't have these diseases. When I think about pig-to-pig contact, I think about our porcine reproductive and respiratory syndrome virus. And it's a virus that causes reproductive and respiratory ailments of our pigs. This is one that is a pig-to-pig disease, but it also has other forms. But the point here is our biosecurity controls are really to test animals prior to entry. And so that's why we advocate for both isolation and testing of animals when within a certain period of time before they move from one phase to another. And that way we can do detection whether a particular pathogen is present, and also looking at the different types of tests we use. So things like PCR versus ELISA to detect how early in an infection a disease might be. And then lastly, aerosol is another big concern. Obviously for influenza A, we do look at this, but other diseases like PRRS, some people have utilized whole herd barn filtration using HEPA filters, and there's been a lot of research done on that because we want to ensure from outside air getting in, we can have some degree of control of small viral particles that could infect pigs. And then other things that we do is enact sick leave policy for workers, because if we have sick workers coming into pigs coughing, we do know there can be transmission of influenza, not just from pigs to people, but people to pigs. And that's been a proven research fact. One of the diseases that we have recently that's really given our industry pause is African swine fever. And why is this disease important? Because it's a foreign animal disease, and this is what we call an industry killer. If this disease comes into the U.S., literally the farms that are affected would need to be depopulated, because it can be a very contagious disease of swine. It has various modes of disease transmission that we all take into consideration when we're assessing biosecurity. So pig to pig is very common. This is a blood-borne virus, but it can be on saliva and some degree in manure, but also in urine. It can be transmitted in milk for lactating sows and as well in semen from boars. But the other problem is African swine fever is very labile in meat and meat products for a very long period of time. Cold does not denature it, only high heat. And so if you have people bring in uncooked meat products and the pigs get exposed and consume that, then you now have transferred that disease. And so these are all the type things we consider when developing our biosecurity plans. The next part, I want to give you just a little brief overview of what we call pig flow and how a lot of us veterinarians view our herd and herd health. And so looking at our pyramid, really what happens is we look at different types of farms, basically from the highest herd health status down to the lowest herd health status. For any of these type of farms, we don't want to introduce disease because disease is not something we want to deal with, both from the health of our pigs and from the financial impact. And so when we look at what are the highest health of a farm that we need to protect, and that would be our boar studs, because there's very much fewer boar studs that service multiple farms than there are of any other type of production. And so our boar studs that deliver semen down to reproducing females, they can cover, 20, 30, 40 farms or more. And so if our boar stud gets sick, it significantly impacts a lot of things down in the pyramid. And so we will have our highest degree of biosecurity and steps and measures in place at boar stud. The next level down is our multipliers, and that's really the grandparents or parents to our breeding stock. These are farms, again, that are held in very high herd health status, not just because of their ability to create animals, but because the genetic potential and the research that goes on the genetic potential of these animals. And so they're probably one step down from a boar stud, but also have very high health status. The next level, or third level, is commercial sow farms. These are females that produce pigs that essentially go to harvest. And while they're not as high as the other two, anytime a disease gets into any type of sow farm, there's significant repercussions financially, because these sow farms are not as easy to depopulate and they are very, very costly. So for example, if a farm gets the porcine epidemic diarrhea virus into 1,000 sow farm, that can cost upwards of $500,000 in a month's time just for the outbreak and loss of animals alone. And so producers have a very high degree of concern for any disease coming into their herds. And then lastly, our commercial nurseries and grow finish are animals that are raised essentially to go to harvest. And these farms, while they have biosecurity, the one issue they have that's a little different from the others is these farms are typically run all in, all out. So all animals come in at one time and then they are marketed out at the same different time period all at once. So the barns have a cycle where they're filled and emptied and allowed to be down, whereas some of our other farms in the same pyramid can't do that. So just to show you flow, this is what we call a farrow to feeder. So a sow farm that raises nursery pigs that eventually go off-site to grow out to harvest. But we have multiple barns on one location. Caretakers commingle within these farms. So while people have departments, they do all help out with different chores. And so when we speak about biosecurity, we can't do it just for one barn. We'd have to take into consideration the whole farm. A different type setup we have is our sow farms that wean pigs directly to a finishing barn. And this is what we call two-site production, because we try to take advantage of having the different phases of animals grown differently. They also have different caretakers by site, which also allows for a little bit more separation of ages and a little bit lessening of risk from some of the sow farms to the grow finish sites. So where does the rubber hit the road? What we look at, really starting from the outward boundaries of the farm in, and some of the terminology we utilize on the farm is creating a line of separation. And we look at this both on the micro level directly at the farm, but also on the macro level, looking at coming into a site or a property. So the picture on the left depicts an aerial view of a grow finish farm. And so the yellow line around the farm property shows the line of separation, and typically you have to have certain things and certain procedures to get into the boundary of a farm. And then if you can see the red line around this herd, there are also different steps to get physically into the barn. And so these are all intended, again, to keep pathogens out that are not intended to be on the farm. Specifically for transportation on the right, we look at the line that we don't want people to cross is where a truck backs up to a farm chute in order to load pigs either in or out of the farm. And so this imaginary line is where farm workers do not cross into the truck, and the folks loading and receiving the pigs in the truck do not cross over into the barn. Again, this is just another step of protection to make sure pathogens don't transfer where they're not wanted. So what happens then when we want to have folks go into the farm? A lot of these procedures are followed on farms, but I can't say that every farm does everything, but these are things that we do recommend. So first and foremost, we suggest people have a barrier, because again, if you have a gate or even a locked gate, it is a lot less likely that you'll have people drive in unwanted vehicles or other things coming into a farm. So when a person comes into the farm, they should be approved to enter. Then we actually have them record in a visitor logbook where they've been last seeing pigs, what date it is, who they're with. That way, in the event that a herd does break, we can also use that as part of traceability to see what may be the reason for a farm having a particular disease. The middle picture depicts on the bottom the entrance into a shower-in facility. And so what happens, people basically shower in on the dirty side where the lockers are, place all their personal clothing in there, step into the shower, take a full shower, hair, nails, body, then step over where the red towels are, dry off, and then on the clean side or farm side, and then wear farm clothing and footwear to do their daily work. This happens in reverse when workers leave the farm, so that way we're also working on biocontainment and not having pathogens go back into people's vehicles or into their areas and on their clothes when they leave the farm. And if people are working outside the barns, we do request they wear separate or clean coveralls and boots when entering the farm property to work. So what are some other things that we do take into consideration? Some of our farms have the threat of feral pigs around them, and you think, okay, why is that an issue? Because feral pigs can carry diseases that we don't want even in commercial barns. And so we want to make sure that when folks are working in the farms, they clean up feed spills, they have gating and penning and even electric fencing that don't invite other animals or wildlife into the farm. We want to make sure people have downtime when they're dealing with other pigs or exhibitions before coming back into their own farms, because again, contact with other pigs can stay on clothing or on hands, and we want to make sure that that's not brought back into the farm. International travel is also an issue because a lot of times people want to bring their own food and food products back into the U.S. And sometimes those meats can be potential source of virus that we don't want to bring in. And I'll go back to my example of African swine fever, of being able to be brought into illegally brought in sausages or meat products. And then if that garbage gets into pig production, it can cause outbreaks. And we know this does happen because in other parts of Europe, that's been illegally disposed of garbage and meat products has infected other pig farms and created havoc in other countries. So other things that we do really looks at our PPE of workers, because we want to do a couple things. Obviously protect the health of our pigs, but also protect our workers. And so we encourage companies and even individual producers and workers to establish, if they don't have one, and then utilize, if they do, sick leave policies. That if you're sick, if you're coughing, if you have a fever, stay home. Don't come to work and don't take a risk of infecting your coworkers or potentially the pigs that you work with. And so other things we do recommend is vaccinations such as influenza, because again, that can maintain the health and safety of workers, and most employers will cover that cost so people don't have to bear that alone. And then farms provide PPE such as masks, specifically N95 working in barns for dust protection, but other pathogen protection. And then gloves and clothing and footwear that help prevent slips, trips, falls. Also don't get folks exposed to, bodily fluids or bloods when helping with animals that are birthing. And then ear protection. And it's all very important that we educate our people working with these things and be mindful of their own protection as well as animal protection. And then lastly, the picture on the right is some of our work that we've done on fairs and exhibitions. We've done that with the help of public health veterinarians, coming up with guidance, especially if you're going to a fair or have contact with a fair, and how to protect yourself from the live animals and not get sick. And this can be both bacterial and viral issues, such as work with a veterinarian at the fair to monitor the health of the pigs. If you do go into a barn as a viewer, make sure you wash your hands after you handle a pig or a petting zoo. Make sure that you don't eat or drink or put anything into your mouth if you're in the animal barn. And then also having a warning for young children or people with additional risks and compromised immune systems to take additional precautions or potentially not even visit the animal barns. And so these are things that we advocate highly with our producers and in our associations. Another step we encourage is a cleaning, disinfection, and drying. That's, to me, is a very basic and simple tenet for anything that we do. If we can reduce the pathogen load, we reduce the chance of infecting animals and having their immune systems be able to handle any potential infection. And so whether it be a trailer that's used to move animals within the barn or even on our equipment and clothing, we want to make sure that we remove manure, any used shavings, dust periodically, and keep spaces clean and free of that type of debris. Use appropriate and labeled disinfectants to kill pathogens. We do utilize a lot of disinfectants and different types within production and target our research to make sure that they can kill the pathogens that we deal with. Plus, being in pork production, we have to ensure that we're utilizing these products that are geared for food animals and in barn use. And so that's looking at the EPA approvals as well. And then lastly, looking at drying, there's a lot of things that can be done even with cleaning with soap and water and then disinfection, but drying is really the last key step. And that can be either forced or naturally. A lot of our trailers are baked. And what that means is after cleaning and disinfection, we'll actually force air into these trailers and hold the air in the trailers until the interior temperature of the trailer reaches 160 degrees and is maintained for 10 minutes. There's been research that shows that will kill a lot of pathogens, including a lot of our bacterial challenges as well. And so this is something we highly encourage, again, to stop that break in potential transmission. Another one that we look at is feed risk. And this has been a science that's been up and coming and research probably since mid to late 2000s or teens, about 2015, because we found that some of our enteric pathogens like PED actually could be carried in feedstuffs. We've known this with Salmonella, but looking at some of our other viral pathogens and the ability of them to survive intact and get into the barns has been a big concern. And so therefore, we're also developing more in-depth biosecurity procedures, basically from source of feed ingredients to feed manufacturing and delivery onto the farm. And that again includes clean and disinfected feed trucks and cabs of the tractors. Drivers wear foot coverings when going to the farm, and then also limiting visitors to our feed mills, because again, trying to prevent the introduction of pathogens into areas where we're making feed for a lot of different farms. And then lastly, but not least, is looking at manure management, because with any of animal production period, there's the issue of how do you deal with the manure. And a lot of producers utilize this as a very effective fertilizer source and works with different contractors to help remove that from the farm and apply out onto the fields. We do know from research that manure can be a source of potential disease introduction because certain pathogens and viruses can survive longer periods of time in manure under different conditions. And so the physical spreading and out onto the ground can be an issue, as well as potential aerosolization, depending upon how the manure is spread. And then lastly, again, foam might spread on equipment and vehicles. And so we also have these biosecurity protocols for people that are dealing outside of the farm, but dealing with products that are coming from the pigs and could potentially infect back to the pigs. And so again, clean and disinfect and make sure people are aware of the potential of disease transmission. So what are the things that we're doing for support in production? We've got several different programs out here. The first one is our Pork Quality Assurance Program, and this was developed back in 1989 really to look at food safety. And the reason is because there had been some work done on sulfa residues that were traced back to the use of sulfa medications in feed and subsequent issues in the harvest channels with meat in harvest channels. However, biosecurity is an integral part of this program, and the program has morphed over the years to include not only the food safety aspect, but public health and environmental impacts, animal welfare, and biosecurity. And so all of the different things that we've just talked about are incorporated into our PQA Plus plan. This program is also significant because almost 100% of all of our producers are involved in this plan. We don't require it as mandatory. However, our harvest channels do, because they know this incorporates all aspects of production and food safety, including antimicrobial tracking. And so that's very, very critical for us. The other part is looking at secure pork supply. And so this is another one that was developed more recently, and this was done really to address foreign animal disease introduction. And USDA was the prime funder of this, but it was also done with state, producer, and even university support. And what this program looks at is how to keep producers viable in the event of a foreign animal disease introduction, and that farm is in a quarantine zone but not infected. And so biosecurity is a key component of this because it ensures and gives a certification to our state veterinarians that producers are doing everything possible from a biosecurity plan to testing and tracking that says they can move animals with confidence knowing they are not infected with diseases. And then the last group is our U.S. Swine Health Improvement Plan. And this is a pilot project for swine that really takes after a similar measure in the National Poultry Improvement Plan. And that plan is really looking at prevention of poultry diseases from getting into the food chain, and specifically looking at high path avian influenza, but there are other diseases with that. And so for the SHIP pilot program, biosecurity, again, is also integral to this particular plan, and ensuring other producers follow both secure pork and PQA, and the biosecurity stated in SHIP is contiguous with the other two programs. Our resources that we have available for all producers really covers a lot of different things. On the far left, it shows our guide for youth exhibitions, because a lot of our youth show pigs, and this has been a long-term and long-standing way for young people to get into swine production and have passion for agriculture through 4-H and FFA. And so we wanted to have basically our biosecurity guidance tailored to what they're doing and how they can help maintain biosecurity for themselves and for their pigs. We created posters that can go into farms for both producers, how to enter and exit farms, how to deal with visitors, what they should do, how to deal with international visitors, and then lastly, the posters that we can post literally at fairs and expositions. So all of these things are guidance and resources that are available to producers, to associations, to FFA, 4-H, anyone that is involved in pork production and exhibition. Another resource is looking at our feed mill biosecurity. And again, since this is a newer area, K-State has really come out with a lot of specific guidance for feed mills and their managers and how they should be handling feed, and a lot also with the Food Safety Modernization Act to prevent other hazards from coming into food and into feed mills. It's not just the pork industry that's looking at this, but the American Feed and Ingredient Association, who supports all of our mills and management and ingredient handling for all species, also has biosecurity guidance for a lot of their members. And so all of these programs, we stay in touch. They have very similar messaging and message points because, again, our goal and priority is to protect both our animals and our workers, because if we can't do that, then we as veterinarians are kind of falling down. And so we want to ensure food safety and human safety. So that's been kind of a very 30,000-foot review of what our reasoning, logic, and rationale is behind pork production and why we're looking at this. And so, as you can see, biosecurity is critically important to us and how we look at both the protection of our pigs and protection of our workers. And a lot of these protections also stem over into protection of our consumers by how we raise a healthy, wholesome product for people to consume. You know, when we look at any of our plans, it's got to meet basic science criteria and address true disease transmission, but also disease risk. And by that, we can't have producers doing a lot of very complex, intricate, difficult things that don't address the true risks and transmission, because if we do, they won't get done. And we have to make our different plans simple, easily done, and routinely incorporated into everyday routines. We do have a lot of support from our industry to producers, and also work with other entities outside of the swine industry, such as the feed industry and public health veterinarians and USDA, to make sure our biosecurity messages and focus is all very contiguous with other industries and other entities. And one thing I didn't mention, but I'll put this in summary, is I think we all face a changing risk landscape, and different things in the swine industry, I think, has really brought that home for us. Back in 2009, obviously with the pandemic, H1N1 influenza, and then also when we dealt with different influenza strains that went from swine to people in 2012 and 2013. And even more recently, as we look at COVID-19 and what impact that had on our plants and the safety of our workers in close proximity to each other. And so my point is this: we have to be able to change and adapt to the changes that are occurring in our landscape and have continuous improvement in our biosecurity. I'd like to think that some of these challenges have improved what we're doing in our protocols, because all of us try to implement different and better things as we assess the herd health of our farms and also the safety and health of our producers. And with that, I'll open it up for any questions. And again, my apologies for the presentation snafus. Okay, the question is USDA says ASF may be transmitted by stable flies. There is work that's being done looking at that because stable flies do, take a blood meal, and if they go back with that blood meal and can potentially transmit that back to naive pigs. The method really that we do look more to is pig-to-pig transmission or even with contaminated fomites. However, I think flies and insect control is something that we look at in our farms routinely because we do know other more routine pathogens in the U.S., such as our enteric pathogens and even our PRRS virus, can be also transmitted versus biting flies and insects and mosquitoes. And so we do have pest control and pest management, especially for insects, as something that we have producers do, especially in summer months. Not so much in winter, but we do that as well. Well, again, I appreciate the talk. I hope it was informative. And again, my apologies on the technology.
Well, if there are no more questions, we'd like to thank everyone for attending, and we especially would love to thank our 3 speakers for agreeing to present for us today. You will be receiving evaluations, and in order to get your certificate of attendance and your certificate of CE, you will need to please complete those certificates. So just to let you know, our next seminar series will be next year, February 9th. And if there are no more questions, have a good afternoon.